Press.
So everyone should now have the ability to record the Zoom. We'll also record a copy and send it out after this is wrapped up. All right, thank you all so much. Senator Ossoff, over to you.
Thank you, Jake, and thank you everybody for joining me this afternoon. I will be very direct and very frank. This bill is a catastrophe for healthcare in Georgia and for Georgia's economy. This bill will push hospitals and nursing homes to the financial brink. It will result in substantial increases in health insurance premiums for hundreds of thousands of Georgians and risk hundreds of thousands of Georgians losing health insurance altogether. And it will do major damage to the renewable and advanced energy sector that is driving so much of Georgia's economic development. Let me walk you through each of those. This bill is a $1 trillion cut to Medicaid. 70% of Georgia seniors in nursing homes are on Medicaid. Half of all births in Georgia are covered by Medicaid. 40% of all children in Georgia are covered by Medicaid. And I have been warning for months that this gutting of the Medicaid program puts Georgia seniors, Georgia mothers, Georgia children at risk. Second of all, this legislation guts key provisions of the Affordable Care Act that lower health insurance premiums for middle-class families in Georgia. This legislation will result in thousands of dollars higher health insurance premiums for middle-class families in Georgia. The Atlanta Journal-Constitution's analysis was that this gutting of the Affordable Care Act will throw more than 300,000 Georgians off of their health insurance. And third, the renewable energy sector, solar manufacturing, battery production, electric vehicle manufacturing, that are core to Georgia's economic development right now, where Georgia, because of the manufacturing incentives that we passed several years ago, which are now being destroyed, Georgia has made out better than just about any other state in the country. This bill is a direct attack on the industry that is driving Georgia's economic development, job creation, and wealth creation in our state right now. So again, this bill is a disaster for the state of Georgia. It guts the Medicaid program and puts nursing homes and hospitals at risk. It will drive up health insurance premiums for working and middle-class families in Georgia. And it takes a hatchet to the fast-growing industry that is driving Georgia's economic development. That is why I oppose this bill. That is why I worked so hard to defeat this bill. That is why even some Senate Republicans oppose this bill. And I call upon the Republicans in Georgia's U.S. House delegation to put Georgia ahead of partisanship and oppose a bill that is bad for Georgians' health and bad for Georgia's economy. And happy to take your questions. Thank you, Jake.
Great, thank you, Senator. Again, thank you all so much for joining us. We'll have time for a few questions now. We'll see how many we can get in. If you have a question, please feel free to use the raise hand function under reaction. You can also just pop into the chat if you'd like to ask a question and we can unmute you from there. So we'll give everyone a moment. All right, we'll start with Liza for 11 Alive.
Thank you for your time, Senator. Can you also speak to the impact on SNAP? Because the cost sharing could be especially detrimental to states like Georgia, where we've got new payment error rate data out showing that we're going to be on the top tier if this cost sharing pushes through.
Yes, in addition to the attack on healthcare in Georgia, on hospitals, on nursing homes, and the increase in health insurance premiums for working families and middle-class families, this bill guts nutrition programs that working families in Georgia rely upon. And something else I want to note, this is a budgetary and fiscal disaster. This legislation will add trillions of dollars to the national debt. And all for what? All to pay for tax cuts for the rich, pushing hospitals and nursing homes to the brink, driving up health insurance premiums for Georgia families, taking a hatchet to the industry driving Georgia's economic prosperity and adding trillions of dollars to the national debt to pay for tax cuts that overwhelmingly benefit the very wealthy. It's wrong for Georgia. It's wrong for the country.
Great. Thank you, Senator. Over to Tia.
Hi, Senator Ossoff.
Hey, Tia. Hey, Tia.
I, I just wanted to ask, what are you guys hearing about what's next? There's some comments made by some of the senators that there's a chance it even goes to the House, then has to bounce back to the Senate again. Just any insight you can give us as to what comes next, and are you guys being told you might have to keep working on the bill?
Look, the House of Representatives should reject this catastrophic bill. And every single member of the U.S. House from Georgia should vote against this bill. Voting for this bill is betraying the state of Georgia. You all saw North Carolina Republican Senator Tom Tillis warn that the Medicaid cuts and the attacks on the renewable energy industry would be devastating for North Carolina. Well, the same is true for Georgia. Will Georgia Republicans summon the same courage and independence that Senator Tillis showed? Or will they put partisan loyalty and loyalty to Donald Trump over the state of Georgia? That is the choice for Georgia Republicans in the U.S. House right now. How can they, with a straight face, say they care about Georgians' health care if they're voting to push rural hospitals and nursing homes to the brink, gutting Medicaid, driving up health insurance premiums? How can they say they're committed to Georgia's prosperity when they're taking a hatchet to the industry driving our economy's economic development? How can they say they're serious about fiscal responsibility when they're adding trillions and trillions of dollars to the national debt? So the Republicans in Georgia's U.S. House delegation face a very clear choice: partisanship and loyalty to the president, or loyalty to our constituents in Georgia.
Great. Thanks, Tia. I'm going to try to get three more in real quick. From Greg Bluestein, he asked, would love your reaction to Republicans who say this is Trump delivering on promises made about taxes.
This is Donald Trump throwing working families under the bus, gutting the healthcare system, pushing hospitals and nursing homes to the brink of bankruptcy, trying to destroy the industry driving Georgia's economic growth so that he can pass a huge tax cut for wealthy political donors. That's all there is to it. This is a betrayal of working families and the middle class, and a betrayal of the state of Georgia. And Greg, just go up to Cartersville, go up to Dalton, go up to the folks in conservative leaning parts of the state who are benefiting from this renewable energy boom in Georgia. Do they want President Trump and their members of Congress to undermine job creation and wealth creation in Georgia communities? You know, there was a time when members of Congress put their state's interests first. And if Georgia Republicans in the House support this bill, they're putting partisan allegiance and loyalty to the president above the state of Georgia.
So thanks, Greg. We'll go over to Doug with ANF.
Thanks, Jake. Hey, Senator. I was curious, by the numbers, this was a bit of an uphill battle for Democrats, especially in the Senate. Does it just kind of go to show the importance of the upcoming 2026 midterms and, the dire need for Democrats to up their numbers in the chamber?
Look, elections have consequences. And with their majority in Congress, instead of addressing the affordability and cost of living crisis, the Republican majority, I'm distressed to report, is choosing to give handouts to donors, tax cuts for the rich, driving up health insurance costs, gutting Medicaid, and damaging Georgia's economic development. So, that is the reality of what we face right now in the Congress. Elections do indeed have consequences.
Perfect. Thank you, Doug. And we'll wrap it up with Ariel with AJC.
Hey, Senator, thank you for doing this.
Sure.
I one thing that I'm really curious about, what do you make of, I mean, all the research that you're citing is really pretty clear. The 300,000 figure is conservative. Even if, by some odd chance they come back and subsidize the ACA before the end of the year, you're still going to have tens of thousands minimum of Georgians losing their health insurance. And a lot of these people are in rural areas. They vote for the GOP, and there is no groundswell of hospital CEOs marching against this bill. And the research is quite clear that these impacts are going to happen. Why is there no support? Why are Democrats like you the ones saying this is going to happen? What do you make of the lack of allies you have on the other side?
Well, Georgia hospitals, Georgia nursing homes, Georgia nurses, Georgia doctors have been sounding the alarm for months and months. But Republicans in Congress have not been listening. And this is a betrayal of rural Georgia. This is a betrayal of working class and middle class families in Georgia. You just laid it out. We're talking about massive increases in the cost of health care for working families and hundreds of thousands of Georgia families potentially losing their health insurance coverage altogether. Rural hospitals being pushed closer to bankruptcy, if not into bankruptcy. Nursing homes facing immense financial strain. It's a betrayal of seniors. And I have heard from those hospitals and nursing homes and doctors and nurses. They have been up here making their case on Capitol Hill. But my Republican colleagues have not been listening. And unfortunately, it's our constituents who will pay the price.
Is there any fear of going public?
Can you clarify the question, please?
Right. For example, I was recently at a press conference held by Democrats where there was one physician who was very well placed to talk about the dangers of the bill. She did not say where she came from, which is Emory Medical School and Grady Healthcare. There was no hospital CEO there. Is there any kind of concern that they have? It's very odd to have something that's really has such clear impacts coming down the pike. I called I called Representative Austin Scott's office about Irwin County Hospital having been listed as likely to close or suffer services that close if this bill passes, and they didn't respond. I'm just wondering why.
Look, it is elected Republicans in Washington who are choosing, despite all of these warnings about the devastating impacts on healthcare in Georgia and Georgia's economy, to march in lockstep with the president at immense cost to our state. And you talk about people who are speaking out. I mean, the Associated Press, Ariel, reported yesterday that more than a dozen sitting Republican state legislators in Georgia wrote a letter begging that Republicans in Congress not take a hatchet to the renewable energy sector, which is driving so much of Georgia's economic development. So I don't think that the story is that Georgians have not been crying out and advocating against this bill. The reality is that national Republican politicians from Georgia are not listening, don't care, are willing to throw our state under the bus, because the reality that we all know is that in today's Republican Party, it's loyalty to the president above all else, even at the expense of our constituents in Georgia.
Thank you.
All right. Thank you, Ariel. Thank you all so much for joining us. Apologies if we did not get to your question, but if you have follow-ups, please let us know. We will get you all the footage as well as soon as it processes. But thank you all so much. If you have any follow-ups, please let us know. Senator, thank you so much.
Thanks, guys. Take care.